You need to watch this if you struggle with chronic pain. Understanding the fog. What is fibromyalgia? Fibromyalgia. It's a word that can sound complex and intimidating. But what does it really mean? Let's break it down. Behind this medical term lies a common condition that affects millions of people worldwide. It's not just a rare or obscure ailment, it's something that many people live with every day. Imagine feeling like your body is constantly aching, as if you've just finished an intense workout, even though you haven't moved a muscle. This persistent pain can be felt in muscles, tendons, and other soft tissues. Now imagine this pain coupled with overwhelming fatigue, making even the simplest tasks feel impossible. Getting out of bed in the morning can feel like climbing a mountain, and staying awake during the day can be a constant battle. That, in essence, is the reality for many living with fibromyalgia. It's a condition that doesn't just affect the body, it affects the mind and spirit as well. This chronic disorder amplifies pain signals in the brain, making sufferers overly sensitive to even the slightest touch. A gentle hug or a pat on the back can feel excruciating. It's not just about physical discomfort. Fibromyalgia can also impact your emotional well-being, sleep patterns, and overall quality of life. Many people with fibromyalgia experience anxiety, depression, and sleep disturbances, but understanding what fibromyalgia is the first step towards managing it effectively. Knowledge about the condition can empower you to seek the right treatments and support. In the following sections, we'll delve deeper into the symptoms, diagnosis, and potential ways to find relief from the grip of fibromyalgia. We'll explore the various treatment options, including medications, physical therapy, and lifestyle changes. Remember, knowledge is power, and by arming yourself with information, you can take charge of your health and well-being. With the right approach, you can manage fibromyalgia and lead a fulfilling life. Living with fibromyalgia doesn't mean you have to give up on the things you love. Many people find that gentle exercise, such as yoga or swimming, can help alleviate symptoms. Eating a balanced diet and staying hydrated can also make a big difference. Support from friends, family, and healthcare professionals is crucial. Joining a support group or talking to a therapist can provide emotional relief and practical advice. Managing fibromyalgia often requires careful planning and pacing. Keeping a daily routine and setting realistic goals can help you stay on track without overexerting yourself. Self-care is also essential. Taking time to relax and do things that make you happy can improve your overall well-being. Whether it's taking a warm bath, reading a good book, or listening to your favorite music, find what works for you. Remember, fibromyalgia is a part of your life, but it doesn't define you. With the right strategies and support, you can manage your symptoms and live a fulfilling life. Stay informed, stay positive, and take it one day at a time. In the end, it's about finding balance and making choices that support your health and happiness. Embrace the journey and know that you're not alone. There are many resources and communities out there to help you along the way. So let's continue this journey together. In the next chapters, we'll explore more about fibromyalgia and how you can take control of your life despite the challenges it presents. Stay tuned and remember, you're stronger than you think. The many faces of pain, common symptoms. Fibromyalgia can be a chameleon, often mimicking other conditions, which can sometimes make it tricky to diagnose. This condition is characterized by widespread musculoskeletal pain, accompanied by fatigue, sleep, memory, and mood issues. Researchers believe that fibromyalgia amplifies painful sensations by affecting the way your brain and spinal cord process painful and non-painful signals. The pain itself can be widespread, affecting both sides of your body, and can fluctuate in intensity. It can be felt in muscles, ligaments, and tendons, and is often described as a constant, dull ache that has lasted for at least 3 months. This pain can be severe enough to interfere with daily activities and can be exacerbated by physical activity, stress, or even weather changes. You might experience it as a dull, constant ache, or it could come in waves of sharp, stabbing sensations. These sensations can be unpredictable, making it difficult to plan daily activities. Some people describe the pain as a burning or throbbing feeling, and it can move around the body, affecting different areas at different times. But the discomfort doesn't stop there. Fibromyalgia is often accompanied by a range of other symptoms that can be just as debilitating as the pain itself. These symptoms can vary from person to person and can change over time, making it a complex condition to manage. Many individuals with fibromyalgia also grapple with tender points, specific areas of the body that are particularly sensitive to touch. These tender points are used by doctors to help diagnose fibromyalgia, as they are often located in predictable locations on the body. These points are often located on the neck, shoulders, back, hips, and elbows. When pressure is applied to these areas, it can cause significant pain, even though the pressure might not seem intense to someone without fibromyalgia. Beyond the pain, fibromyalgia can manifest in a variety of ways. One of the most common and debilitating symptoms is chronic fatigue. This fatigue is not just feeling tired after a long day, it's a pervasive sense of exhaustion that doesn't go away with rest or sleep. Fatigue is a frequent companion, leaving you feeling drained and lacking energy. This can make it difficult to perform everyday tasks and can significantly impact your quality of life. The fatigue can be so severe that it feels like you have the flu, and it can be accompanied by a lack of motivation and a feeling of being overwhelmed. Sleep disturbances are also common, making it difficult to get a restful night's sleep. Many people with fibromyalgia experience sleep disorders such as insomnia, restless leg syndrome, and sleep apnea. Even when they do manage to sleep, they often wake up feeling unrefreshed, as if they haven't slept at all. Other symptoms can include morning stiffness, headaches, irritable bowel syndrome, restless leg syndrome, anxiety, and depression. These symptoms can create a vicious cycle where pain and fatigue lead to poor sleep, which in turn exacerbates the pain and fatigue. Unmasking the invisible. Diagnosing fibromyalgia. Fibromyalgia is a complex and often misunderstood condition that affects millions of people worldwide. Its symptoms can be debilitating, yet it remains one of the most challenging conditions to diagnose. Diagnosing fibromyalgia can be challenging because there's no single test to confirm its presence. Unlike other medical conditions that can be identified through specific tests or imaging, fibromyalgia requires a more nuanced approach. This is because its symptoms often overlap with those of other conditions, making it difficult to pinpoint. It often involves a process of elimination, ruling out other conditions that share similar symptoms. This means that your healthcare provider will need to conduct a series of tests to exclude other potential causes of your symptoms. This can be a lengthy and sometimes frustrating process, but it is essential for an accurate diagnosis. Your doctor will begin by taking a thorough medical history and conducting a physical exam. They will ask detailed questions about your symptoms, their duration, and their impact on your daily life. This information is crucial in helping your doctor understand the full scope of your condition. They may ask about your pain levels, sleep patterns, and any other symptoms you've been experiencing. For instance, they might inquire about the intensity and location of your pain, whether you experience fatigue, and if you have any cognitive difficulties such as memory problems or difficulty concentrating. Assessing the tender points, those hypersensitive areas of the body, can also provide valuable clues. These tender points are specific spots on the body that are painful when pressed. The presence of pain in at least 11 out of 18 designated tender points has traditionally been one of the criteria for diagnosing fibromyalgia. In some cases, your doctor might recommend blood tests to rule out other conditions that can mimic fibromyalgia, such as rheumatoid arthritis or lupus. These tests can help ensure that your symptoms are not being caused by another underlying condition, which is a critical step in the diagnostic process. It's important to be patient and persistent during the diagnostic process. Diagnosing fibromyalgia can take time, and it may require multiple visits to your healthcare provider. It's essential to keep track of your symptoms and communicate openly with your doctor about any changes or new symptoms that arise. Don't hesitate to advocate for yourself and seek a second opinion if you feel unheard or your symptoms remain unexplained. Sometimes a fresh perspective from another healthcare professional can provide new insights and lead to a more accurate diagnosis. Remember, you are your best advocate, and your persistence can make a significant difference in managing your health.